Hello, it is August 31st, and we are here today with Dr. Maria van Kerkhove, who is the technical lead for the COVID response at the World Health Organization. And I am going to turn it over to Maria to tell you about what her career path looked like, how she ended up in this position, and what she has been doing for the last 20 months to end the pandemic. So Maria, over to you.
So Rebecca, thanks for having me in this. And you asked me about my career path. I think all of us sort of in this situation, we all had a love for diseases and outbreaks and infectious diseases and, trying to prevent the worst from happening. My career has been a series of opportunities and luck and working really hard, and a supportive family and husband and, just kind of taking life by the horns and kind of, taking those opportunities where I could. My background is in infectious disease epidemiology. I've always been interested in epidemiology, even before I knew that was a field, that was a technical field. I love the idea of thinking about viruses and how viruses affected some animals and sometimes infected humans and sometimes didn't, and how people dealt with those diseases. And I was really interested in these emerging pathogens, these things that appeared to happen in far off locations. I grew up in the US, and so I read about them, but we didn't experience them in the US. And in doing my studies, I did a master's in epidemiology at Stanford. I did my undergraduate at Cornell. I did a master's at Stanford, and I did my PhD at the London School of Hygiene and Tropical Medicine, where I chose that school because of their work in global health. At the time in the US, there were a lot of universities that had some professors that worked overseas, but it wasn't really well known. It was not part of the norm, which it is now, because we're a completely global interconnected world. And so in my PhD work, I was linked up with Institute Pasteur in Cambodia, where a professor of mine at London School said, oh, if you want to do emergency response or outbreak investigation, you need to meet my colleague Surendra Vong at Institute Pasteur in Cambodia. And I sent him an email, and he said it was a connection, and he said, please, come and let's develop a project. And I worked on H5N1 avian influenza in Cambodia on and off for about 2 years. Everything I know about One Health before it was called One Health was in Cambodia, because it's just what you did. You collaborated, you worked across different sectors, you worked with different disciplines, you worked with the village chief, and you worked with the veterinarian officer at the district level, and you worked with the community workers, and you worked with epidemiologists and clinicians, and even the media, in that respect, to kind of understand what was happening. And I learned a lot in the field. And I loved my time in Cambodia. And then it was just a series of choices with jobs. I finished my PhD in April of 2009. And at the time I was based at Imperial College, I was offered a postdoc to work with WHO and to be the liaison between the center I was in, which was the MRC Center for Outbreak Analysis and Modeling, Neil Ferguson's group, mathematical modeling. I'm not a modeler. To see how the statistics and analytics and modeling work of Imperial could support WHO programs. And basically, I worked with staff here in WHO to develop projects to say, okay, what goals do you want to achieve with this program, and how can modeling support that? And then the 2009 flu pandemic hit. So I was embedded within the flu program. And I've just been working on and off with WHO since then. And I wholeheartedly believe in the UN. I wholeheartedly believe in WHO and what we are meant to do. We are not perfect in any respect, but our mandate and our responsibilities are great. And I am a very, very proud employee of WHO. And I think I'm in the right place at the right time. So that's kind of how that's a long-winded answer of how I got here, but there was no plan. There was no, I am going to do this. I've had a lot of people come to me and say, I want your job. Like, how did you get to that job? And of course, that's just not how it's happened.
No, it's all the accidental career, right?
Yeah.
So tell us, like, what was your job in late December, early January of 2020, and kind of how did you what did you end up doing when the novel coronavirus emerged?
So I was, before all of this started, I was the MERS coronavirus focal point, the technical lead for MERS. And I was acting as the unit head for the unit that I'm in now. I now lead that unit called Emerging Diseases and Zoonoses. We've changed names over the last several years. It's now called Emerging Diseases and Zoonoses. And, my job was to develop prevention and control programs around these high threat respiratory pathogens, focusing on MERS, but using MERS as an example of a novel coronavirus or a novel respiratory virus, not flu. So we have a whole flu team. And I'm not part of that flu team, but of course we work very closely together. And so we were developing, guidance materials, we were developing trainings, we were developing information products. We were trying to advance research and development on vaccines for MERS in humans and in camels. We were developing protocols for clinical trials for new therapeutics and for vaccines. And I was doing a lot of presentations around the world about, high threat respiratory pathogens and like try to integrate respiratory disease surveillance. And because all of these programs, you don't want these vertical programs on MERS or flu or Lassa, or, we try to integrate it based on the risk that's in a country. And in December 2019, I was in the States. I was on holiday for Christmas with my family. I have 2 young boys, and my husband and I, with our 2 young boys, were in the States. We were at my sister's, having, a lovely Christmas holiday with lots of food and lots of people and lots of laughter and lots of noise. And, something always happens at the Christmas time or the holiday times or a Friday. It doesn't have to be a holiday, but there's always something that happens around the holiday period. And normally it's a suspected MERS case or a suspected case that travels from, the Middle East, for example, to Asia or the Middle East somewhere. And there's always this alert of a potential MERS case in a new country. And that to me, always tells us that the systems are working for surveillance and for alerts. What we heard on the 31st was a cluster of pneumonia of unknown etiology from China. And when you hear of a cluster, that means more than one case. When you hear pneumonia, you hear respiratory. When you hear of unknown etiology from a country that has strong lab systems, you know that they've already ruled out some of the major culprits. It's not flu, it's not MERS, it's not SARS. And so that automatically raises alarm bells. And given that it was December in the middle of the flu season, of course, the hair sort of stands on end. And so we immediately activated all of our systems. I mean, the emails were kind of flying. I didn't get a phone call. A lot of people ask me, did you get a phone call in the middle of the night? Nobody gets phone calls anymore. I mean, it's all email and WhatsApp and Signal and things were happening pretty quickly. We automatically pulled our teams together with our country office in Beijing, our regional office in the Western Pacific, and me being the coronavirus focal point, I was automatically, brought into it right away. We had our flu team involved. Our ADGs were involved. Our executive director was involved. I mean, we were all activated, and it was just questions. What do we know? What do we need to know? What is being tested? In the beginning of any situation, it's what is it? How is it spreading? What disease does it cause? What is the extent of infection so far? And how do we stop it? So it's the same questions every single time. And then, we organized lots of teleconferences to kind of bring together what we knew. And every opportunity you have to learn about something, you ask 50 more questions. So it's just about information gathering and then making sure in the country where it's reported, like China, what's being done? What are they doing to find out more? Because part of it is not only asking the questions, but having the confidence that some work is ongoing. And you can say, okay, we'll give you a couple hours to come back to us, or you need a couple of days or whatever that may be. But it was happening really, really quickly. And my job immediately, once we activate our incident management support team, our IMST, as part of our emergency response framework, I was the technical focal point for coronaviruses. We thought, immediately it could be a coronavirus, given that these other pathogens were, could be ruled out. And we immediately started thinking scenarios. Immediately, I have this document that went through all of the scenarios. a spillover event, because a lot of the initial cases were linked to a market. So the big question was the market the source, or was the market the amplification event? So normally when you have a cluster of pneumonia, people are really sick, they seek healthcare. So that means you have to automatically go back in time. There were probably milder cases that were occurring earlier. And what actually is the scope of this? Is it something real, or is it not? Is it a false? The lab results were not right, and you have to go back. So we thought scenarios: spillover event, very limited, a one source, one source of infection being the market. Was there a spillover and limited human to human transmission? And now that has a funny connotation now, but it's true, because in respiratory diseases, you can have limited human to human transmission, meaning amongst those close contacts. And this we thought could be possible because we heard family clusters or whatever. And then it became bigger and bigger. So is it in Wuhan? Is it in Hubei? Is it in China? Is it beyond the borders of China? And so we were working through scenarios, and my job was to develop the materials that to help countries get ready, a readiness checklist. How ready are you to deal with a novel respiratory pathogen? Most of the world, the answer to that is not ready. And unfortunately, we've learned that, and then we quickly adapted the materials that we had for MERS for this novel coronavirus. And so we were rapidly pulling together our international networks. We were advising, we were revising the guidance to get something out, to get a package out. So within 2 weeks of the cluster, the learning of this cluster of pneumonia of unknown etiology, we had a full package of guidance published online. We also had published the first PCR assay, the essential recipe for developing a PCR test. And that is what was used to start the development of PCR tests that we started shipping by the end of January. So it was intense. It was busy, but it was focused. I mean, a lot of people were like, oh, is it chaotic? It was not chaotic. It was super intense. It was driven. Everybody was like laser focused on what we needed to do. This was not a drill. And so because we have this emergency response framework, we kind of automatically went into this structure. And because it was the holidays, we didn't have hundreds and hundreds of people around. So we kind of started small, and then we just got on with it.
So I remember seeing you on the pressers after the emergency committee meetings for whether to declare this public health emergency of international concern, and then have subsequently watched you in pressers multiple times a week. It seemed like every day, and then multiple times a week.
It was every day at one point. It was even Saturdays and Sundays. Yeah.
And what has that been like? I mean, you have in many ways become kind of the face of the WHO and communicating what is happening throughout the pandemic.
I mean, I did one press conference on January 14th, where I was giving the one and what I thought only press conference about the event itself. And I thought, oh boy, I didn't stick to the talking points. I gave an overview of what we would expect based on experience with other coronaviruses. And the headline from the Reuters article was WHO puts all hospitals on alert and warns of super spreading events. And that turned out to be a pretty good title at the time. But it was people took that as quite alarmist. It's really funny the position WHO is in. We use all of our mechanisms to share information and to raise the alarm bells. And either we're too weak or we're too strong, or, there's a very delicate balance, but we raised our alarms and we're raising them. I never thought I would be a public facing person in a situation like this ever. I'm not trained for this. It's been an incredible privilege. It's been a huge responsibility. It's been incredibly stressful, but it's been incredibly rewarding because I have the opportunity to come back. It's not like a one-off. So I'm not perfect in my communication, and I know that. I'm not trying to be perfect, but what I'm trying to do is I'm trying to explain complex situations, complex topics as succinctly as I can, believe it or not, but explain what we know, explain what we don't know, and explain what we as WHO are doing with our partners to find out. So that to me is one of the most important things. It's not just about saying we don't know yet, but it's about saying, look, we have these collaborations in place. This study is underway, that study is underway, and we expect some results in 10 days or 5 days or 3 months, but kind of setting those expectations. But this has been a big challenge for me because it's not my main job. And, you know, we have this joke that it's not a joke, that every time we speak, it's, you know, it's a possible career ending moment. And the responsibility is huge because what we say matters, and we take that very seriously. None of us come up here and flippantly just give our advice. My opinion on a certain topic doesn't matter, but my voice on explaining what WHO understands from our partnerships, from the scientific community does, and it has implications. So that carries a lot of weight. The social media side of things, and that I have to say has been incredibly difficult. A lot of it has been positive, but much of it has been negative and really hard. And I'm a human being, you know, so if someone accuses me of killing somebody because of something that I've said, I don't know how to process that, because I'm really, you know, my only goal is to help people. My only goal through my job and through the partnerships that we have is to help people. So it's been, it's heavy. It's a little heavy.
And we've talked about this before. I think it's a position that many of us in the field were not prepared for, and have had to step up. And it's been really for me kind of exciting to watch you step into this role and how you've managed it. I know we don't have too much time left, but I was wondering if maybe you could speak a little bit to, you know, you said that the comms piece is only part of what you do in a given day. What are you working on right now? I mean, clearly the pandemic is still here. It's still going. Yeah. It is, it's not getting better, unfortunately. So what are you working on right now?
So, you know, we're filming this 20 months into the pandemic, and, you know, we're in a situation now where we reach sort of this plateauing of almost 4.5 million cases per week, which is astonishing. It's shocking to me, given that we have tools that can prevent people from being hospitalized, prevent people from dying right now. And there are major challenges that we're trying to address. One are these virus variants. So the virus is evolving. So everything that we do on a daily basis. So my responsibility as the technical lead, as the health operations lead, is the development of guidance, the development of trainings, development of these information products that get the guide, not only the guidance in its technical form, but translate that to people who can use it. So we're constantly revising this. We are constantly revising our guidance on laboratory aspects, on infection prevention control in health facilities and outside of health facilities, our public health and social measures, our therapeutics, you know, on and on. And we are working with our guideline development groups, and we're evaluating the evidence in light of the virus variants. And the latest variant of concern is Delta, and Delta is much more transmissible. We're trying to understand why. We're trying to understand if the impacts on severity, not just hospitalization, and how that affects our guidance and our advice. And we're also taking this into consideration in the context of vaccination rollout, which is incredibly uneven and inequitable. And so we have a situation 20 months in where the virus is spreading. We have virus variants. We have a highly susceptible population because we don't have vaccines in the arms of those who need it most around the world. We have the inconsistent use of public health and social measures. We have confusing messaging. And, you know, it's a dangerous situation. So my day-to-day is around the guidance. My day-to-day is around pulling together all shreds of evidence that we can on every particular topic we can. It's a series of meetings throughout the days, it's teleconferences, everything is virtual these days. So we meet with our clinical networks, our laboratory networks. We have a virus evolution working group that's teasing through every mutation that we see, and then the constellations of mutations that end up as variants of interest, variants of concern. We're looking at how these impact our guidance on public health and social measures, as well as vaccine composition and everything in between. We're trying to improve surveillance to make sure that everything starts with good fundamentals of public health surveillance, active testing, not just PCR testing, but antigen-based testing, that we have good sequencing, and we have improvements in sequencing worldwide because we need good eyes and ears out there. And everything that we are doing right now for SARS-CoV-2, will be beneficial, not just for SARS-CoV-2, but for the next one. So our belief, my wholehearted belief, is that preparedness is a constant. There is no start and stop. Everything that we do now is an investment into the future. And if we don't make those investments now, I don't know when we're going to. So we're thinking about what we need to do now for the long term. We're also trying to address, misinformation and disinformation and confusing messages, because we need an informed and an engaged and an empowered community to be, to take this crazy ride with us. But these two tracks of, people thinking that this pandemic is over versus ICUs overwhelmed and people in hallways, to me, I'm really, really struggling with. You go outside and you see restaurants full, but then the schools are closed, and you see the bars open, but you see the hospitals full. And so it's a matter of priorities. And I don't think we've gotten it quite right at a global level in terms of finding the right balance between the measures in place to bring transmission down, but take the death out of this, because we actually have the tools at hand that can do that. So on a day-to-day basis, it's about partnerships. It's about implementing the SPRP 2021. It's about fundraising. Frankly, we don't have the money right now to actually implement this. And I do a lot of presentations at scientific conferences to try to get the word out. And then we have all the origins work. So again, I'm sorry, it's a long-winded answer to answer your question, but again, I work with, amazing people here in HQ, in our regions, in our country offices, but as well as partnerships around the world to kind of, push this forward. So it's long days, it's long nights, it's long weekends. But, we've got good people here working on this, and I know we will get to the other end of this.
Well, Maria, we are so grateful for everything you have done. We are so grateful to your team, to your family, and really for everything you've done throughout your career, but particularly through the pandemic to date, and everything that you will be doing as the pandemic continues. So again, thank you so much for your time today and for your contributions to the world. Thank you.
Thanks, Rebecca.